So I'll introduce our panelists. First, we have Dr. Angela Kaida, the Scientific Director of the Institute for Gender and Health at the Canadian Institutes for Health Research. We have, come on up. It's like The Price is Right. This is so fun. We also have Jessica Chalk, the founder and CEO of MyStoria. Next, I'll introduce Mallory Bronfman-Thomas, who's a program manager with the United Nations Population Fund. Come on down. And last but not least, we have Stephanie Gann, the Director of Governance and Partnerships at Health Emergency Readiness Canada. In one line, I would love for each of you to describe what Canada's leadership in Femtech means to you and what makes this moment feel different from the past.
The one word is opportunity. And I think it's we all have our eyes on the same problem, and we're bringing together different approaches and expertise for solution. And I think that is the opportunity of our moment.
I would say collaboration. I think women's health is a whole body conversation, and it involves so many different levels of expertise and stakeholders coming together to make real change. So I'd say collaboration.
And I would say the next frontier is really about moving from pilots to system level adoption. And what makes this moment different is finally the public will investment appetite, as well as the incredible growing research and innovations are finally aligning.
For where I am coming from, I think it is a matter of representation and influence on decision making, and therefore the capacity to have impacts. You will all be really quite aware of how the federal budget came out last week, and it is this government that really senses that it is a time of generational change. From that perspective, then, the time is now to seize the moment for bold action and to have that impact.
Awesome. So, to kick off the first section of our panel today, which is research to real world impact, we've heard a lot today about how data and evidence are the foundation of progress. They can help us to understand where the gaps are, who's being left out, and when interventions actually work. But to move those insights beyond the lab into products, programs, and policies that reach women where they are is a bit of a question mark still. The challenge and opportunity is connecting that excellence in research that we've heard about today with innovators, investors, and employers to deliver measurable outcomes for women and for our economy. So we want to explore a bit about how we can start to bridge that gap. So Angela, I'm sorry to pick on you first again, but we've heard a lot today about how Canada is leading globally in sex and gender-based health research policies and methodology. So just wondering if you can share a bit about how that research is being mobilized for implementation and what we need to better connect what's happening in the lab and women's research into what's happening in the market.
I guess I'll answer this in a way that is going to make you kind of happy at the beginning, and then it's going to make you mad. So I just want you to know that I already know that. But I have to start by saying that, yes, here in Canada, we have a policy. So I'm with the Canadian Institutes of Health Research. So we have a policy that requires every health researcher applying for public dollars to do health research to talk about the sex and gender considerations of their research. So this is not about like, please, sir, can I have some more? This is, if you want this money, you have to talk about sex and gender considerations. And it's not about whether are you doing work in an area that is known for women's health. It's no matter what you're working on. So you want to do active transportation research, you want to find, cancer cure research, tell us about the sex and gender considerations of your work. I have to tell you that was very controversial to introduce that as a policy. I can also tell you that when you make things mandatory, people do it. When we started the policy, about 30% of CHR investments for health research had applicants that were talking about sex and gender. And now our latest numbers are somewhere around 90% of our investments talk about sex, and about 50%, 45, 50% talk about gender. And there's a very good reason for that. Most of the research we fund is in the basic sciences. So I don't really know if rats have gender, but most of that work is happening in biological sciences. So that proportion makes a ton of sense. And I think as Canadians who have expectations of our scientific community, this is good news. This is important. That's an important development. Okay, so this is where we feel a bit good, I think, right? So after 10 years, a lot of training, ensuring that peer reviewers also consider sex and gender as not some checkbox exercise that we do on the side, but we say this is a critical for the quality of science that we are producing in this country. We should all feel really good about that. Now, your question is about implementation, right? Taking it through to knowledge mobilization. Dr. Brotto gave us that stunning stat of 17 years from your research to your translation. Now, what I have to tell you is that applying for grant money and doing research are not the same. Okay, so we see that researchers do talk about sex and gender when they're applying for money. All of us know the work of applying for money or asking for money. You're going to create some works of fiction as part of that. Is that? I hope that's not just me. That is the part of the sales, right? But when it comes to analyses where people have actually looked at in our scientific evidence base, what proportion of the publications are also reporting on sex and gender, just even stratified? We're not doing discovery variable analysis, just stratified. And we see an immense fall off. So we've started to see that yes, men and women are included in studies. That's getting better. Yes, male and female rats and mice are being included. So that's getting better. But are we presenting that data in a way that anybody could see what the outcomes might be that are different for men, women, gender expansive people? That's my bad news story. That part is not happening. So when you talk about commercialization, I'll just say to everybody in this room, you need good data. We are on the same side. Yeah. You want an evidence base that is specific to the community, the people, the lived experiences, the disease focus that you're interested in. You need the evidence from our research community to do that, and you need it published. So we are on the same side of that effort.
Great point. Wondering, Stephanie, from an ISED perspective, if you can comment a little bit about how federal innovation policy can maybe help to bridge that research to commercialization gap that we're seeing, ensuring that all of these discoveries and research are being translated and reaching markets.
Absolutely. There is a very important role for the federal government to be helping bridge that gap, facilitating that conversion and that translation, commercialization process. It is not a challenge unique to women's health, though, from what we were talking about today, I think there's some things that are particularly unique to the sector. I think the question does assume that there is innovation and research to start with, and that's very important. From our discussions, it sounds like that is less the issue than other things. Though we should not neglect, I think the STEM pipeline and ensuring that. Those innovations continue to be developed. A big piece, though, of ensuring that that happens and the pipeline to commercialization is, however, representation. So this is why there are such things as the ISED 50/30 challenge, encouraging organizations to make sure there is striving towards gender parity in leadership positions. The idea being that it makes a difference when women and those who are gender diverse are at the table. The biggest, I said, innovation program is the Strategic Innovation Fund. Recipients of those funds are required to report on their gender and diversity impacts. Policy is not the solution to everything. Mind you, what we're aiming for is a behavior and a culture, perhaps shift to where we want it to be, where the entire system and the entire pipeline is targeted making sure that innovations do get to market so that they can have impact. This maximizes what is happening in the system so that it can actually change lives. But what this means is that we had heard a little bit of this. Academics do need to be planning ahead from a stage that almost doesn't make sense, where it is from the basic level you don't even know what it looks like in the real world, but at the back of your mind there needs to be a bit of space and time for that. The universities and institutions have a role as well. We heard about the tech transfer offices. They should be there alongside academics. They should know that the women academics are not necessarily the ones that will come to them. They should be able to have the capacity to identify the promising ideas, providing the support, talking, having those chats about potential licensing and IP, finding them connections to funding so that they can increase the transfer value of their innovations. That's with the academic system, but there should be a connection as well to industry. We heard about how there needs to be this testing out with potential companies and early stage investors who, from the policy perspective, we're finding they want done deals. They're not willing to take on the risk. And so there's a policy role there to de-risk or share risk so that they are more able to. But those of you who are looking for these ideas at the early stage, you have to understand that there is a risk involved for that reward. But back to the policy side, there are a lot of funding programs that are supposed to facilitate this process. What we hear is that it is an incredibly complicated system to navigate. It is very fragmented. There is a CIHR, the Granting Council, NRC, there's us. It's a bit messy. But it is that in the budget, as I was mentioning, there is some very clear investments. It's a particular context at this time, so non-negligible sums of money towards dual use, military and civilian commercialization projects for the kinds of things that this government wants to see done. There's there are shout outs in the budget if you're looking for them. So yes, it wasn't women's health, but life sciences has a big piece here. And I think from the asset perspective, there's room here for women's health, the supportive health of women and gender diverse individuals in the military. But the budget is really an opportunity, I think, for on the government side to be finding better coordination, to be able to maximize the resources that we have to bring the most value and impact to all Canadians, including Canadian women, at a time where maybe it matters a lot.
And I wonder, as Femtech founder, I'm wondering if you can share a little bit about how research has been used in the way you developed My Story as technology, and maybe you can share a little bit about the product itself as well, and what kinds of collaborations you think will be critical for your next stage of growth.
Before my story was anything, I was a patient on a really long fertility journey. I spent 6 years in clinics in both Canada and the US because I couldn't get what I needed at the clinic I had in Canada. But I also spent over $100,000 of my own money through savings and remortgaging our house to try to have a baby. Unfortunately, it did not work out for us. In year 6, we walked away. And one of the things that I think is so important as I thought about my story was the fact that there's a seat at the table for patient innovation. And there's a seat at the table for, as Dr. Brado said, patients and end users being involved in innovation in early stages because we're the ones living what we're going through. And there's so much to be said for that in how you're driving what you're building, but then how you're actually going to go commercialize that. Just that to start. But then what I realized from being a patient and not a researcher or an academic that or a clinician that there's a portion of the story that I did not understand. And so when I started kind of going about, okay, I had this problem. I don't understand how I got to year 6, spent this money and walked away. There's so many I wish I would have known. I talked to patients first. And I was like, is it just me? Did anyone else experience this? And then I kind of looked at, okay, there's so many of us saying the same thing. Let's go figure out what the other side says. And so I basically harassed in the most kind way a number of fertility doctors and OB-GYNs and tried to understand, okay, what are you experiencing on the patient side? Like when you're talking to patients, what is it like? What is the clinical setting look like? And very early on, I had 4 fertility doctors all in on my Mystoria with me, helping me kind of build out what we were trying to do. So Mystoria, our kind of long-term vision is for patients to be this single source of truth of their health care and their health data in complex care. We're starting in fertility, reproductive health, women's health, because this is such a huge unmet need, and we need to be able to know how to communicate our health to our care practitioners. So, as I was going through and talking to academic and researchers, there's a couple things that really stood out to me that I learned. One was that there's big gaps in the in between. So, in between your specialists, or in between different stages of care, or in between different appointments, that you go home as a patient and you are trying to fill those gaps with things to do, knowledge or stuff, but there's very little tools and a lot of noise and misinformation out there. The second thing that I've learned is, especially in going through fertility, women's health, is it, a lot of what actually delivers or contributes to your outcomes does not live in a clinical setting. It lives in what's happening at home, what you're eating, your stress levels, I don't know, traumatic events that are happening outside of it. And none of those are captured, or oftentimes we don't even know to communicate those to our care team, too. And then the third, I'd say, and I really tried to make it to only 3, so I'm gonna go back to my third one that I really wanted to say. Oftentimes, when you're talking about reproductive health or fertility, I forget who said it, but someone else on the panels, or a previous speaker said it, but often you're discovering chronic issues in your health or women's health at the time where you're realizing you cannot get pregnant and something's going on. I've talked to people that realize they're basically diabetic. They've got cervical cancer. I've talked to so many people that didn't even realize to go dig into something. For me, it took 5 years to get an endometriosis diagnosis, and that wasn't until I realized, and the TMI, but it's not TMI in this room, that I like painful sex wasn't normal. I didn't know that. I didn't know to communicate that. And so that for me was a big thing. So for next steps, like for us as fertility and looking at kind of what impacts, basically it's your whole body that impacts your fertility. I think it's so important to collaborate with others in industry, academics, researchers, and kind of come together to figure out how do we actually help the patient lean into their own care and make shared decisions.
Thank you for sharing your story with us, Jessica. I think it's really impactful and amazing to see how you were able to build such a beautiful product and experience for people from that. I know we've talked a lot today about how women's health is one of the biggest untapped economic opportunities in Canada. And I know, Mallory, that UNFPA has been able to, through the Equity 2030 Alliance, has been able to mobilize billions of dollars in gender smart capital globally. And I'm wondering if you can share a little bit about that, what the Equity 2030 Alliance is, and any lessons that we can take from that experience in that program.
Maybe speaking first a bit to the data, and then I can move a bit
Yep.
to the investment. So, we all know here that biased data produces biased innovations, and the importance of gender inclusive design, gender equitable design, and having women centric solutions at the fore. Now, I just want to first say how smart it was to set up the panel in this way, because I really can see people from different aspects of the ecosystem being able to share that perspective. So kudos to Femtech Canada. I read a statistic recently where it shared that surgeons across most provinces and territories in Canada get reimbursed 28% less when performing on female patients. And that's across the board. And this climbs up to over 30% in the US. But in my bureaucratic institution of the UN, in an email, when I heard that, I was just like outrageous. And usually you're a bit more diplomatic via email, but that really just sent me. And we've been hearing so many of those stats today. We were starting to think through like what contributes to this. And if we're going to play the devil's advocate here, because we know that outside of this room, we always hear the devil advocate's opinion. And they will say, well, maybe these procedures are more complex. I would say to that, aren't we as women always the ones that were told we're too complicated for this? Shouldn't they be reimbursed way more than for performing on women and female patients? It's just, it doesn't make sense. And how does that really play out in the case of why doctors are reimbursed so much more when doing an ultrasound on a single testicle rather than someone pregnant with twins? It's just absolutely mind blowing to me. And so the reason I share these, and I think we've heard a lot of this today, is just these are symptoms of a broken system, of a system that does not value women's bodies. It does not value women's healthcare work. And so the world was not designed for women. It really wasn't. And this is a principle that we hold close to us at the Equity 2030 Alliance is that we need to redesign the world. And I really sit here coming from such a different perspective because coming from a multilateral, things can be at such a high level. And I'm so grateful to be hearing the incredible research that's being done, the specific experiences and stories of people like yourself that are actually creating companies from the experiences that they're engaging in. And so, what does this mean for Canada and for the world? So, the thing is, having gender inclusive design really ensures that we have women and girls' voices heard from the start, from the design to the development to the deployment of what we're doing. And in Canada, we're so lucky to have such a diverse community because then gender inclusive design really means that we will get such a breadth of women's perspectives and experiences and cultural contexts. And that allows us to position ourselves in a way that we can scale these solutions globally. We can support women and girls around the world in a very different way. And so I think what I've heard today is that it's less about having to do the gender inclusive design for this audience because it sounds like everybody really does. But it's more about communicating that, like you had spoken about with the knowledge communication. And so this is what the Equity 2030 Alliance is here to really support with, is to get the stories out there, to mobilize funding. And maybe I'll just pause there because I've been speaking a little bit, but I'll just leave it at the data and I'll get back to the funding later.
Awesome. I'm wondering, Angela and Jessica, if you can speak a little bit to how you're making the economic case for your work. Angela, a little bit about how you consider that, or how much attention is being paid to the economic value of femtech in your conversations.
I think that the conversation of linking women's health to economic value and productivity has been a really loud and clear message of the last year, right? So we now have this data from McKinsey that closing the women's health gap is a $37 billion economic opportunity annually per year. Oh, okay. And we have a really good blueprint of how to do that. Right. As researchers, we have a blueprint. We've said, like, from a research perspective, we need to count women, we need to study women, we need to invest in women, we need to care for women, we need to support and promote women in leadership positions. So the economic argument to me is actually very powerful. And we've got our colleague here from ISED that I think sometimes women's health is sort of pushed aside. It's made small. It's like we can't complain, or we just power through. You can withstand this pain. And I think first, everybody knows that that's total bullshit. But second is that we cannot have the economic advantages of this country without healthy women. I mean, this is such an obvious kind of a point to make. And I wanted to pick up on the person who would ask the question about why do we have differences in like IP requests. Is that person here? I'm just pointing. Okay, which was amazing, and thank you for sharing that data. And one thing I just wanted to add to that conversation is how we approach women. So I think we can stand back and we can say, oh, I wish more women would apply for their IP, applications. But if we've learned anything from senior women's leadership is that women will read, this is a scientific study, women will read a job description and they will say, okay, oh, I don't meet every single one of these qualifications. I am not qualified to apply for this job. And study shows, I'm sorry to our male colleagues in the room, that men will read the same list of qualifications and see that they have one and apply to the job. And so this is I think that's amazing. And so I think if we can take that same thinking, right? We need to do more in this economic productivity. We need to connect women's health. We need these IP applications coming forward. We need tech founders to show up, and we need them to see that their work is high value. They don't have to have every qualification to get there. And that's going to require a tapping. That's going to require a calling in rather than us waiting for some the patriarchy to change, to get those numbers more equal.
So my previous business, I took a small amount of angel investment, family and friends, and then paid that back and built that off revenue. So raising capital is like a whole new thing for me. And my pre-seed funding round, I had the like absolute luck, and I recommend this for anyone, and I hope to do this in the future for others, of having a mentor who's just a killer female entrepreneur that was by my side from day one and just like pushing me forward. And so I super lucky from that perspective. But I realized as I was going into some of these more institutional conversations, I was like, no, 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 look at the TAM, SAM, and SOM. It's massive. Look at that. And then you realize, okay, wait a second. I actually have to make the economic case for this, both from the perspective of the impact on women's health in general, but on the conversation that a lot of people I've heard back, depending on the who's in the room, is fertility super niche. It's basically IVF. That's the classic one. IVF and fertility are synonymous in a lot of people's minds, which is totally not the case. And so it then came down to the numbers, and I actually, going back to collaboration, relied heavily on McKinsey reports that have come out recently that we just heard about, Femtech Canada and all the information and stats there, and what I could pull out. And one of the ones that I definitely like come from like an aha moment is the discussion. Two things. One is patients spend an absorbent amount of time at home researching, digging, looking. Like the stats like 124 hours a year, which is equivalent to effectively 3 weeks of time. Like that's an crazy amount of time on top of everything else you have going on in your life. And so then I started to think about, okay, well, there's also a stat that it's the U.S. Reproductive Society. Less of all people struggling to conceive, less than 15% of those actually need IVF. But so much focus and funding is around IVF. So why is there not more upstream support? And like, if you can get people in front of more upstream support earlier, what does that look like? Which then broadened the conversation on market from an investor perspective, which also then, okay, help people earlier, reduce downstream costs, make it a lot of sense too. So it was a process of elimination and a lot of collaboration and reports, like working with some of the reports as well, that kind of helped me figure out how to talk with investors.
Awesome. I want to pivot a little bit because I know we're short on time. We're trying to move through a lot of questions really quickly. But we heard today about the need for an updated women's health strategy in Canada, and that there's a need to collate some of these different provincial level women's health strategies, that we really need a lot of collaboration and coordination between our provinces and at the federal level. And I'm wondering what you think it would take to build a national movement around women's health innovation, and what steps we need to take as a collective ecosystem.
I will, though I would say that normally you don't turn to government necessarily to ask the question of how do we build a movement. Maybe I would say something about how it is that government sometimes is compelled to act. It is that the economic case has, in a number of other policy areas, been a really crucial one to getting things on the agenda. So, in terms of women's health, I think the economic argument is in some ways really quite fleshed out, and that's fantastic. The idea that there's this huge untapped value that is not being realized. That there would be a significant contribution to economic activity is one, obviously, that I said is very interested in and swayed by. But maybe I would also say that, maybe a couple more things. There was, a little bit of a mention of, GBA plus, In 2018, there was a Canadian Gender Budgeting Act from the inside of government. We who are supposed to move things, make priorities happen based on the direction of the government. It was a significant development. In that it made some commitments for the Minister of Finance and and the President of the Treasury Board to do some reporting on a gender and diversity impacts basis for the budget and for program expenditures. So they were on the hook, but obviously other ministers and therefore departments were implicated because of their subject matter and policy leads. This has translated into departments being required to develop the capacity to do this kind of program impact reporting. And the departmental results reports, that's where you want to want to look to find these things. It is that the capacity is being developed, and so we're not quite there yet. It is one thing to say that you're going to do it, and another for those impacts to substantively be reported. But the idea is that the accountability is now out there. The requirement for the transparency is out there, and it at that point is almost the passing of the baton. It is the public, it is the stakeholders, it is the ecosystem that is able to hold the system to account for what impacts are and are not realized. That leads me to, I guess, the second part of my answer, which is government is often compelled to act because Canadians tell them they should. That means that you have your argument. That means you are a little bit organized in a narrative that our decision makers of this day respond to. So, for different levels of government, for different parliamentarians in particular, that could mean different things. It is just for the government side, I am not sure that I can tell you specifically what that looks like. But I would say, maybe in general, that Femtech Canada has done a significant amount of work in the ecosystem to advocate, to mobilize, to coalesce around some of these narratives and to find allies to be able to make this case much more visibly, and which makes it much more likely that the decision makers will be compelled to act.
I really am taken by two of your comments about the public. So like we are the public in a way, So I think mobilizing as as women, as patients, as people who have to encounter the healthcare system and like just knowing that there is a supportive movement behind us is really important. And I think the work of Femtech has been very eye-opening for me in the sense of when Femtech speaks about the importance of women's health research, it lands differently, does it not, than the scientific director of an institute of research? Like, it lands differently because we're saying that we are all partners in the same cause, right? So that it's not that I have a self-interest in research or what have you. But I think that vision to say we have to bring different actors together to this problem is our path to a women's health strategy. So it's not a niche topic. It's not something that is in the domain of only people who care about gender equity, or it's only in the domain of people who have had fertility struggles. It is in all of our collective domain, and that's how we get to a women's health strategy. So just thank you to Femtech for your leadership in this conversation.
Yeah. And thank you too for collecting such a diverse group of individuals. I think it's really cool to be in a room like this with people from so many different industries. I'm going to turn it to our last question for Mallory because we heard a little bit about what it might take to create a national movement, but I'm wondering if you could share a little bit about how global partnerships and frameworks like those led by the UN and UNFPA can help Canada to scale its leadership internationally.
Absolutely, thanks. And I think the two go hand in hand because when we talk about ecosystem development, it is supporting the agency and the incredible work being done of femtech ventures, of grassroots civil society movements fighting for our rights. And at the same time, global pressure is very powerful. There is something very powerful about being able to look at another country's work on how they've advanced gender equity, how they've been really advancing work across women's health, being able to say, Canada, let's do better. So go to the government who are leaders on the global stage with regards to the feminist international assistance policy and all of these things. Like this matters for the government. And so I think being able to say, yes, there is the economic imperative, which is key, and we've all talked about today, and being able to say, do you want to keep this leadership on the global stage? And in terms of global partnerships and frameworks, it can be really beneficial from the smallest company to the Adobes and the Bayers out there, because for the larger players, you can gain a lot of visibility. You can really demonstrate your leadership on the global stage on that. For smaller ventures, it's also about gaining a sense of credibility. So, the Equity 2030 Alliance brings together partners from across business, academia, governments, other various institutions as well. And we work to normalize gender equity across science, technology, and financing. And if you're a small venture looking to gain publicity and visibility, if you join the alliance, which is free, by the way, you can get the communications assets. You can really demonstrate that you are signing on to something bigger than one commercial interest. We are actually fighting for a global movement as well for women's health. Um, and this brings me to something I'm really delighted to share, because as we advance this work across science, tech, and financing, we realized that we needed to dive deeper and really assess how we can support one another in our shared learning through this journey. And so I am very pleased to share that Femtech Canada will be joining us as a co lead of the technology cluster of the Equity 2030 Alliance. And the technology cluster will work to advance thought leadership to address critical knowledge gaps in the sector specifically. We'll be working with those like maybe Adobe, like these big players who are members of the alliance, to really understand how we can advance gender equitable design through their product development, but then also come to see how in Canada we can really make the country a leader in advancing this work forward. And Femtech Canada is incredibly well positioned to be a co-lead for the cluster, um, advancing the systemic work for women's health, really ensuring that there's real progress across programming and ecosystem building, and also being the organization behind Femtech Across Borders, which supports Femtech initiatives across over, I was going to say 70 countries, but I heard yesterday is 80 countries now, which is phenomenal, to really lead an effort. And I really do implore and call on everyone who is interested to join the alliance, to join the cluster, to start strategically thinking about how we can really start to change things on a fundamentally systems level.
Okay, thank you so much to all of our panelists. That's all the time we have for today. We didn't get to all of our questions, but these individuals are a wealth of knowledge, so I would definitely encourage you to go and chat with them during the networking reception. And thanks again to Femtech for having us all here today.